The coronavirus pandemic brings a new normal to southern Arizona.
This is devastating. I've never seen anything like this.
From school closures to health concerns,
Your lungs can fully expand, and yet it's not helping.
to the local economy.
The way things are headed, we are going to experience and are experiencing a severe economic shock.
Hello and welcome to this special edition of Arizona 360. I'm Lorraine Rivera. The coronavirus continues to spread in our nation and here at home. Tonight in Arizona, confirmed cases top 900, including 17 deaths. But tonight we'll bring you our latest reporting and speak with public officials and health experts about where we stand. You can also find all of our coronavirus coverage and resources at azpm.org. Today, President Trump extended social distancing guidelines through April 30th. That move comes the same weekend Mayor Regina Romero issued an executive order closing all non-essential businesses through April 17th. Reporter Christopher Conover spoke to Mayor Romero earlier today about her decision and what it means for Tucsonans.
On Friday, you issued a proclamation that made some changes to the way Tucsonans are going to be allowed to get out and move around. In simple terms, can you explain what the changes in the proclamation are?
Yes, we extended the date of the original proclamation that I signed on the 17th of March. We moved it to April 17th. We were very conscious that President Trump was promoting people going out on Easter, and so we wanted to make it very clear to the community that that's not the case, that coronavirus and COVID-19 are still spreading and the numbers are growing in Pima County. And so I wanted to make sure that we were absolutely clear to the community that Easter was included in the order, and that people are going to have to spend their Easter at home, maybe connecting through YouTube or other forms to listen in to their Easter Sunday masses, and so that's why we did that. Another part of the expansion of my proclamation was to strongly advise people in the city of Tucson and hopefully in the entire county to stay home. And we are ordering all businesses and establishments that are not essential functions as defined by the governor's executive order to close to the public effective yesterday, which was Saturday at 8 a.m. through the 17th. Another strong advisory is that certain businesses and establishments that the governor's executive order described as essential functions close to the public. And those are personal hygiene type of establishments like nail salons, hair salons, barbershops, spa services.
When it comes to those non-essential businesses that you're asking to close, even though they are legally allowed to stay open, what have you heard from them? This has been in effect for 24 hours. I'm sure you've heard something. What have you heard from them about that request?
Back when I signed my first proclamation of emergency, we received an abundance of calls from these places. And since we're strongly advising that these establishments close because of the proximity that they have with individuals. And so you cannot provide a haircut or do a manicure and a pedicure without being extremely close to people. And what we want to do with these orders are to protect the community, that people should take it very seriously. I don't like to use shelter in place because people feel as though that we're asking them to just stay in. That's not reality. Reality is that we want them to, go out and walk, breathe fresh air, go out of their home. And if they do go out for a walk, that they maintain at least 6 feet from others that they encounter out in the park or just walking their neighborhood.
Is there a point where you may officially disagree with the governor and say shelter in place is best for Tucson despite what the governor says, and put a shelter in place order in?
What I want to do, and I have been in constant communication with the governor's office, I don't want to get into either a political fight over this or a legal fight over it. I want to support our governor in his decision making, but we cannot wait here in Tucson. I mean, we know that COVID-19 is not waiting, and neither should we. I do want to reiterate that these orders do not conflict with what the governor put out in his executive order, but they do push the envelope. And so that's why, you know, in partnership with my colleagues on the council, with advice from our city manager, from our city attorney, from healthcare providers, I did not make this decision in a vacuum. I made this with plenty of advice from doctors and medical providers and my colleagues on the council. And I think the next level of advisory is very important for our community.
All right. Well, thank you so much for sitting down with us.
Thank you so much, Chris, and you have a wonderful day.
In other headlines this weekend, the director of Arizona's Division of Emergency Management stepped down. Wendy Smith-Reeves submitted her resignation to the governor's office Saturday. She has been part of the state's response to the COVID-19 emergency. An acting director has already been named. A day earlier and hours before Mayor Romero issued her latest proclamation, I spoke to Governor Doug Ducey about how his administration is weighing a stay-at-home order for the state.
We are absolutely considering every tool in the toolbox. The authorities given to a governor in a public health emergency are vast. So I want to make the right decisions in the best interest of Arizona to protect our citizens and protect public health and promote good public health. So we have escalated it as this situation has escalated, and everything's on the table right now. We've, of course, shut down restaurants and bars. We've gone to takeout only. Our schools are closed. We've had an emergency declaration. We've had a lot of executive orders, and I expect those to continue to extend to the appropriateness of whatever's necessary. My guidance has been with the Centers for Disease Control and Prevention and Dr. Kara Christ, who is a medical doctor and infectious disease epidemiologist. She's the individual who steered the state through H1N1, Ebola, the measles, and that's where our guidance is, and we'll continue to follow the facts and listen to the subject matter experts.
Many people are questioning how you've decided who's essential and who's not. What sort of guidelines are you operating with to make sure that you have the best information available?
Arizona is not in the same situation as some other states that we're seeing across the country. So we are able to really learn from some of those that are getting hit well before we're going to face that kind of surge activity that will be necessary in the state of Arizona. So we want people, of course, if you can stay home, stay home. If you're sick, you've got to stay home. But if you're part of an essential business, if you're able to work, you're able to, what we say, physical distance. A lot of people are saying social distancing. It's that idea of keeping a 6 feet of distance between yourself and others, just like I'm doing during this interview. You can still go out and do what you need to do.
Any preparation for field hospitals in the state of Arizona?
Yes, all hands are on deck right now. We want to make sure that we have the proper hospital capacity, not only at the state level, but for additional field hospitals. We anticipate, and this is worst case scenario planning, Lorraine, but when you have a pandemic, you need to plan for worst case scenarios. And it would be two additional field hospitals in Maricopa County and one in Pima County, worst case scenario.
There are some vulnerable populations in the state of Arizona, to include the inmate population or immigrants who are afraid to go to the hospital, even tribal communities where some resources like water can be scarce. Are they all being considered during these decisions?
Oh, absolutely. I mean, that's who we're most concerned about is our most vulnerable population, and I'm glad that you pointed that out. First and foremost, it is people that are 65 years old or older with an underlying health condition or a chronic health condition, and we're doing everything we can to keep any spread out of the retirement homes, those communities that we have around our state. That was actually my first executive order. And we're taking that same type of mentality, of course, to our prison inmates, the way we're working with our correctional officers and the off-site work. Our tribal communities are getting hit hard. We've got additional help and assistance from our federal government and the National Guard to pay attention to that situation.
The mayors in border communities like Douglas, San Luis, Nogales are worried about their tax revenue. Arizona has $1 billion in its rainy day fund. Any plans to direct that money toward them?
Public health is first and foremost. After that, my concern is about economic relief, and our great Arizonans that live paycheck to paycheck, have never asked for anything from the government, and all of a sudden there's no income coming in. So with the passage of the economic relief package in Washington this past week and what we're going to be able to do at the state level, we're going to use everything we have, and we've got more than a rainy day in front of us right now. And the good news is we're in a strong financial position to navigate through this together, and we are going to get through this together. This is going to be a marathon, not a sprint. I'm very confident we're going to come out of this on the other side stronger and healthier as a state, but we've got a ways to go. And the first concern right now is public health, to reduce the transmission of this disease, to take care of those that are sick, to try to reduce the amount of deaths that we're going to face. And then we want to make sure nobody falls through the social safety net.
Dr. Crist says we have not hit the peak yet. If we're not going to do things like stay-at-home directives, then how do we smash this curve?
Basically, Lorraine, I've been all over the state. The state is shut down. People are staying home. Kids are out of school. You look out the window at the state capitol, there's nothing on West Washington. There's nothing on the I-10. We'll escalate directives as CDC guidance determines that, but we are anticipating what's going to be necessary for April and May, and that's the way to lower and flatten the curve, to extend this so that we have hospital capacity and we can take care and comfort for everyone that's going to need it.
All right, Governor Ducey, thank you for your insight. Turning now to testing and the pressure on our statewide healthcare system, we are joined by Dr. Kara Crist, Director of the Arizona Department of Health Services. Dr. Crist, thank you for joining us.
Oh, thank you for having me.
Doctor, let's begin with, there's some back and forth about who can be tested, who should be tested. What's the latest right now in the state of Arizona?
So right now, there is a national shortage of the supplies we need to run those tests. So what we are recommending is that high-risk individuals, people who have had contact, who are symptomatic, those that are in hospitals, those that are healthcare workers or required for critical infrastructure, those are the people that we are recommending be prioritized for testing. For individuals that are healthy, may come down with some symptoms, but can stay at home, we are not recommending for testing at this time.
Who would make the determination on that? Is that the primary care physician?
So that would either be the primary care physician or the healthcare worker that you are working with.
Okay, earlier this week you said there would likely be an increase in mid to late April, perhaps a peak in May. How does that translate into the next few weeks here as we move into the spring?
So we know as we increase testing capacity, we are going to see additional cases. And we know that this virus is contagious. It is spreading within our communities. So we do anticipate to see a continual increase in those cases. We are working 80% of the cases from what we are seeing from other parts of the world are going to have a very mild or asymptomatic case, and so can stay home and recover by getting rest, drinking lots of fluids, taking care of your symptoms. But there will be a portion of those individuals who are not mild or asymptomatic and will need either hospitalization or care.
There's some question about the number of beds. One report said 16,000 hospital beds, 1,500 ICU beds, and 1,000 ventilators. Worst case scenario, is Arizona prepared to handle what could be coming later this spring?
So we are lucky. We are behind where other parts of the country who are being significantly impacted. So we have time to prepare. So we are working on building additional capacity in our hospitals, looking at procuring and getting additional ventilators so that we can stay ahead of that curve in Arizona.
There are some communities in rural Arizona that simply don't have a hospital. What would become of patients in need there?
If a patient needs care that's a higher level of care than what is offered in their local community, we can always transport, whether that's by ambulance or by helicopter, to one of those higher acuity facilities in one of our metropolitan areas.
At last report, there were nearly 7,000 tests in a population here in Arizona of about 6 million people. Is there a threshold or a number you'd like to see that would give you some comfort?
So I always want as much data as possible when it comes to population health. I think as of today, we were over 10,000 tests. So our capacity is increasing. And so that's a really good thing. But we know that that's not representative of our community. Very similarly, when we look at flu every year, we know we're just getting the tip of the iceberg because we're just getting those symptomatic people that go into the doctor and actually get tested. But we know that there's a lot of people out there with mild symptoms, and that's kind of what we're expecting or anticipating with this disease.
A high level of uncertainty right now. What is your thought to the public who's watching this and wondering, what happens over the next few weeks?
So this is a rapidly evolving situation, and every day we're reviewing the data to see if there are additional recommendations that we would make. What we would encourage people in our communities to do is to take those very simple steps that they can do to prevent either acquiring or transmitting COVID-19 to somebody else. And that's wash your hands with soap and water, use an alcohol-based hand sanitizer, stay home when you are sick, try to stay at home in general so that you are not in crowds of more than 10 people or out where you could be potentially infected. And you want to make sure that you are social distancing. So when you are out in public, make sure that you stay a good 6 feet away from other individuals that are not in your household.
Dr. Christ, are you confident that Arizona has a handle on this pandemic?
Well, with a pandemic, it's always unpredictable, but we have been preparing for a pandemic for years. We are working very closely with our local health departments, our hospitals, our healthcare providers to give them the most accurate and up-to-date information that we have. We have a great healthcare system here in Arizona, and we are doing everything we can to protect that.
Okay, Dr. Christ joining us from Phoenix. Thank you for your time. Testing for COVID-19 remains the critical factor in gaining a better picture of the reality in our state. Health experts warn the number of reported cases is a fraction of the actual number. AZPM's Jake Steinberg reports.
It started with a dry cough.
When I thought I was getting sick, the COVID thing was, all I knew about it then was that it was happening in China.
That was 2 weeks ago, before the president declared a national emergency.
We will overcome the threat of the virus.
And the country began to shut down. Harper is a 31-year-old network engineer who describes himself as an introvert.
But no, and that was actually what was awakening to how serious this could possibly become is I don't have a lot of contact. I don't shake people's hands. I already wash my hands 40 times a day.
He decided to self-quarantine just to be safe. Last week, he heard Banner Medical Center in Tucson was opening a drive-through testing center. After waiting in line for over an hour, he was told he wouldn't be able to get a test and was sent home. The same thing happened when he went back the next day, after his symptoms got even worse.
You hear shortness of breath. What I think to myself is the feeling you'd feel when you had just finished running really hard, and you can still, catch up to it kind of thing, but it's a strange feeling where it's your lungs can fully expand and yet it's not helping.
Despite his symptoms, Harper still hasn't been tested for COVID-19. That's because there are so few testing kits available. Only the most vulnerable members of the community can be tested. According to criteria set by the Centers for Disease Control, first priority are hospitalized patients and healthcare workers with symptoms. Then it's older adults and people with underlying health conditions. Young people are not a priority, but according to Casey Ernst, an epidemiologist at the University of Arizona, they're the ones spreading the virus. She compares the situation to an iceberg.
The number of reported cases that we see are what's sticking out of the water, right? And underneath are all of the asymptomatic cases, the people who are mild, who haven't gone to the doctor, the people who have gone to the doctor but can't get testing for whatever reason.
She says low rates of testing means it's hard to know how many cases are really out there. But it could be as many as 10 cases for every one reported.
So this iceberg, as it gets bigger and bigger, a larger portion of that iceberg is going to be sticking out of the water. And it's growing at an accelerating rate as well.
She says we're still early in the outbreak in Arizona, but if our trends follow other states, cases could explode this coming week. So the best measures are still for everyone to act like they're carrying the virus. Stay home, keep your distance from others, and wash your hands.
It is clear that testing is so important and where things go from here. To learn more about exactly what this virus is, how it works, and what testing tells us and why we should all take this seriously, we are joined by Dr. Felicia Goodrum of the University of Arizona. Dr. Goodrum, thanks for being here.
It's wonderful to be here. Thank you.
Let's begin with what COVID-19 is.
COVID-19 is caused by a coronavirus. It's called the SARS-CoV-2 virus. And it is a coronavirus similar to many coronaviruses that have circulated in the human population for a long time that cause the common cold. However, this particular coronavirus just moved into the population from an animal species, and that is why it's causing severe disease in humans.
What makes this one so different that it's managed to spread across continents and affect so many people?
This virus is highly transmissible, and it has an asymptomatic period of shed or pre-symptomatic period of shed. So people can be shedding virus and transmitting the virus before they know they're sick. And that has really increased the number of cases and how quickly it has spread. It is also very, very stable on surfaces and can hang in the air for long periods of time. On surfaces, it's stable for up to 3 days in a laboratory, and so that allows greater opportunity for people to come into contact with the virus. And then finally, we have no pre-existing immunity to this virus in the human population, so every person that encounters the virus is dealing with it as a naive host.
Given that it exists in so many different places and it is spread so rapidly, it's now considered a pandemic. Were we in the United States prepared for it, given that we had already seen it in other countries?
I think that's the surprising point to me, is that we had a good 2 months heads up from the time that China announced a severe pneumonia on December 31st to the time that the United States began seeing a lot of cases. And during that time, we should have been preparing, I think, more acutely than we were to increase PPE production, the protective equipment that doctors and nurses need to keep themselves safe. We should have been increasing the production of ventilators and been preparing for what was going to eventually hit the United States. Now the United States has the highest number of cases in the world, and we still have no widespread testing. Every single country that has been able to control this virus, including countries like Taiwan and South Korea and China, have done it through massive testing campaigns where they can identify people who have been infected, are shedding virus, isolate those people, and trace their contacts to further limit the spread. Limiting the spread is our #1 defense against this virus at this point, and this has to be done with widespread testing for the virus.
Once you test and we start the physical distancing, what's the timeline of when we can start to get this under control?
If we really were to have a shelter-in-place order, which means you really do not leave your home unless it's for food or medicine, if we did that, we would be able to start seeing a number of cases, new cases, drop in about 4 to 6 weeks. This virus has a long incubation period of 2 weeks. So people can be infected today. They may not show symptoms for up to 2 weeks. Now, it's important to know that most people will show symptoms in 5 to 6 days, but the incubation period goes for as long as 2 weeks.
If we're exposed, are we now immune to it?
That is the hope. This is a very new virus, and the research is very limited. But what we would hope is that we would get a durable immunity to this virus. That immunity, the durability of that immunity and how long that immunity will last is going to depend on how much the virus is changing. We know this virus is mutating. It's what coronaviruses and other RNA-based viruses do. But so far those changes haven't really resulted in changes that are going to affect our ability to mount a protective immune response. And then of course there's the hope that we'll develop a vaccine that will be able to also help induce immunity in those people who have not yet been infected.
You are a virologist.
Yes.
This is what you study. Are we taking the appropriate steps to start to tamp this thing down sooner or within these 4 to 6 weeks that you're describing?
I think we're beginning to. The response is a little bit slow. We really need to be on top of this before there are hundreds of thousands of cases in the United States. And with every passing day that we delay, there will be a 10 to 100-fold increases in new infections. And so if we wait another day, we are making the problem much, much worse and more difficult to rein in.
Increasing the risk.
Yes.
Okay, Dr. Goodrum, thank you.
You're welcome, thank you.
You may have seen the latest guidelines to prevent the spread of COVID-19, but we thought it was important to reiterate here what the Arizona Department of Health is recommending. Wash your hands often with soap and water for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Stay home when you are sick. Cover your cough or sneeze with a tissue, then immediately throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces. The economy has been hard hit by the coronavirus, with massive layoffs nationwide, a major stock market plunge, and a battle in Congress about how best to provide economic relief. In a typical week, Arizona's Department of Economic Security processes an average of 3,500 unemployment claims. That spiked to 29,000 in the first week that businesses in Arizona closed because of the outbreak. AZPM reporter Vanessa Barchfield examined the pandemic's impact on some small businesses and workers in Tucson.
St. Patrick's Day is usually a big moneymaker at Hotel Congress. Not this year. Instead, it was the day that all of the city's bars and restaurants were ordered to shut operations, except for delivery and takeout.
It went from 100 miles an hour to 0 in the flip of a switch. So that day we had a really awful reality of laying off 160 employees and one not so easy to write email.
Hotel Congress has kept a skeleton crew of about 40 people on the payroll, including security, cleaners, cooks, and managers.
We're just doing what we can to hang on and have the ability to reopen when this situation passes, which we all know it will, and it's when, not if.
Hanley says there hasn't been a moment like this in the 100 years that Congress has been open. And that's true for many businesses and the people that keep them running.
I was the kitchen manager at XO Roast, and I worked at the Coronet. Since we both work in service, we kind of live paycheck to paycheck, so it just was we don't have any money saved. We don't have any sort of like cushion at all. Yeah, it's been hard. I did apply for unemployment last Thursday, and I asked for an estimated time frame of when I would start receiving assistance, and they said a month and a half at the earliest.
The pain has been widespread. The City of Tucson's Office of Economic Initiatives usually focuses on how businesses can grow. That shifted drastically in the past week.
I answered a call today from a moving company. We've had a lot of salons and barbershops and that industry.
Coffee says it's a difficult time for small businesses in our community. And aside from answers, many need one other thing: money.
They're going to need some relief in the short term. So whether that is bills to pay, mortgages, lease payments, what have you. So access to capital is very important.
Back at Hotel Congress, Todd Hanley says it's not just access to cash that businesses need, but the form that cash comes in is also crucial.
As you talk to any small business, they say, well, I don't need a loan if I can't reopen because I won't be able to pay back the loan. We need grants. We need government intervention.
Ramirez and Cousin and Soto say that when EXO and the Coronet open their dining rooms again, not just for takeout, they'll return to their jobs. And there's some silver lining in knowing that they're not going through this all on their own.
We all are here together, doing all this together, and people have been really supportive of each other so far. So I'm like, that's the only thing that we have really to count on. But that's why we're so lucky that we're in Tucson, because there's just such an amazing community here.
For analysis on the economy, how we are being impacted, and where we go from here, we turn to Dr. George Hammond, economics professor at the University of Arizona Eller College of Management. Dr. Hammond, thanks for being here.
Thank you.
All right, let's begin with this talk of a recession that many economists say we are in. How do we bounce back from one?
The way things are headed, we are going to experience and are experiencing a severe economic shock. Essentially, it's a sudden stop to the economy in an effort to control the spread of the virus. And that means that we've seen very strong job losses in leisure and hospitality, the travel industry. Tourism in general has taken a big hit. We also know that we've seen this big decline in the stock market that will affect overall consumer sentiment, as we've seen the job losses, as evidenced by the huge surge in initial claims for unemployment insurance, means that people are going to feel less optimistic about the future and less likely to spend even online. So we're headed for a major downturn. I think we're headed for something that over the next couple of quarters will be on roughly the scale of the Great Recession. So those job and economic losses that we saw during the 6 quarters from the first quarter of 2008 to the middle of 2009. So it's a major downturn that we're headed for. Once we get the spread of the virus under control, then the federal spending, the money that we'll see coming from the federal government will start to have an impact on consumer spending going forward. I suspect that we'll see more federal spending even than we've seen to date, and that will help to boost economic growth. But when the recovery comes, I think it will be fairly strong.
The stimulus, will it help in the interim?
Think of it as more as a stabilization than a stimulus. So what we're trying to do, what the government is trying to do, is to make sure that people can continue to buy groceries, pay their rent, and pay their utilities. So we're trying to soften the blow of the sudden stop in the economy. Once we have control over the virus, people feel like going out, the social distancing is no longer such an important consideration, then we'll see consumers really start to get out and spend again. And they'll probably spend at a pace that will be much greater than we have seen on average over the past couple of years. It'll be a strong rebound.
We're pretty short on time, but I do want to know that prior to COVID-19, Arizona was experiencing extraordinary growth. Anything about what happens in Arizona that puts us on the right path toward recovery?
Arizona is a rapidly growing state. Job growth in February was more than double the national rate. So the Arizona economy is fundamentally strong, and that will serve us well in the recovery and as we look forward to growth over the next 5 or 10 years.
Okay, Dr. Hammond, thanks for your insight.
Thank you.
All right, and we will take a short break now with a message from Arizona Public Media about PBS education programming and resources that we hope you will find useful in the days ahead. We'll be right back.
With Arizona schools now closed, Arizona Public Media and Arizona PBS have partnered to establish a statewide at-home learning program, offering educational programming that aligns with Arizona state standards. In the Arizona Public Media viewing area, the programming on PBS 6, PBS 6 Plus, and PBS Kids will help to meet the educational needs of students by targeting specific curriculum demands for different age groups throughout the day. PBS Kids programming for pre-K through grade 3 runs all day, every day on PBS Kids, AZPM's dedicated kids channel. Programming for students in grades 4 through 8 airs between 6 a.m. and 6 p.m. on PBS 6 Plus. And high school programming runs on PBS 6 from 10 a.m. to 4 p.m. Complete schedules are available at azpm.org/distance learning. In the Arizona PBS viewing area, Arizona PBS has realigned daytime programming on its main channel, 8.1, from 5 a.m. to 4:30 p.m., with K through 12 curriculum to better serve the needs of the community. More resources are available online at azpbs.org/kids and azpm.org/distance learning. As many parents become at-home teachers, you can learn together with the content available every day from Arizona Public Media and Arizona PBS.
Now we continue our special coverage of the coronavirus in southern Arizona. As a border state, we face unique challenges. For more on that, AZPM's Tony Paniagua reports from Nogales, Arizona.
Shut down, locked up, and lacking any certainty about the future. That's the scene in many places around the country and the world, and Nogales, Arizona is a microcosm of that unsettled situation. Downtown Nogales used to be a vibrant and very successful business district, but now it is almost empty, vacant, for lease, or for sale. And the coronavirus is rubbing salt on the wounds.
This is devastating. I've never seen anything like this. The last time I saw something similar, but people were still coming across, was the first major peso devaluation. That's the time that I saw. Maybe it was 70 sometimes, I'm not sure.
Santa Cruz County Sheriff Tony Estrada has been working in law enforcement in this community for more than 50 years. To be clear, he says, the decline in this shopping district was already underway. It began years ago and is always susceptible to international economies and politics.
This was valuable property. I mean, by square foot, this particular first and second block was probably the most expensive anywhere else because it was booming with consumers from Mexico. The sidewalks were full of people, the stores were full of people. I mean, the merchant down here made millions and millions of dollars at that time. And then, of course, that started going away with the peso devaluation.
Fast forward to the present, and now it's the coronavirus. The Trump administration closed the border to, quote, non-essential travel on Saturday, March 21st. Thousands of people are paying attention to expert advice, and they are staying at home in their respective countries. The U.S. government defines non-essential travel as tourism or cultural activities such as sightseeing, entertainment, or performances. Essential travel includes trips for work, to attend educational institutions, medical treatment, or to engage in border trade. And that's welcome news for a multi-billion-dollar industry between Arizona and its neighbors to the south. Much of the produce you see in your supermarket this time of year is provided by the states of Sonora and Sinaloa in northwest Mexico. Once the goods arrive in Arizona, they are shipped to other parts of the United States or even Canada. Jaime Chamberlain's family has been involved in produce importing and distribution since 1971.
I tell people all the time, it doesn't matter how long you've been in the business, you're always going to learn something different every single day. And this has been a heck of a roller coaster for us here.
He says so far the industry is faring relatively well considering the circumstances.
I don't see a great impact to the food supply business. We're very fortunate in that way that we are a critical industry that needs to keep on crossing and needs to keep on working. But there are a lot of other people in our community that are going to suffer greatly for this.
I think everyone's constantly reevaluating this because it's changing from day to day. And the main thing is USDA, FDA, CDC, everyone has said that the possibility of transmission of COVID from food or food services is minimal. And so we tell people to do the same thing you always do, wash your fresh produce and enjoy it.
Back in downtown Nogales, some businesses are trying to remain open, but they're not sure how much longer it'll be possible.
It is worrying to see what is happening to our economy and to think about the possible effects of this virus moving forward. I think we still haven't seen the worst of this situation, so many of us are remaining vigilant. I ventured out today because I needed some things at a store here, but I saw it was closed. I understand them. They're also taking precautions.
This merchant in Arizona did not want to speak to us on camera, but he's reporting an 80 to 85% decrease in customers from Mexico in just 1 week. And this other store is seeing less than a handful of shoppers each day. The manager says the shop is part of a national chain with locations in other parts of the U.S. They may be propping up the Nogales location, but she doesn't know when the higher-ups will pull the plug here, at least temporarily. Still, some Mexican shoppers are crossing the border to spend their money in Arizona. These residents say they needed food, water, and other necessary items and faced no resistance from United States border agents. And the trade works both ways. Miguel Carrillo lives in Nogales, Arizona, but he found it more convenient to buy some coveted items in Mexico.
I get this toilet paper, 12 rolls, and these 4 ones for $4. That's the price that I got from. It's cheaper than here too, because one of these costs $2.77 here. Only one, this is 4. And the 12 is like a triple, like a $8, like $8.
And you got them at the pharmacy?
At the pharmacy called Farmacia Benavides, across the line. I'm not trying to do a commercial, whatever, but that's what it is.
I can count probably the stores that are opened up here, maybe 5 stores that are open downtown. So it's devastating. It's devastating for the economy and everything else. We're going to have to tighten our belts in the county and in the city and cut down on personnel. We're going to have to really go through some really stringent measures to survive this particular situation. We're hoping it's short and it doesn't do permanent damage.
As you heard in that report, the relationship between Arizona and Mexico is critical. KJZZ, our sister station in Phoenix, has a special team dedicated to covering issues between the two nations. I'm joined now by Kendall Blust and Murphy Woodhouse, Fronteras Desk correspondents with KJZZ. My thanks to both of you. Murphy, I want to begin with what's happening on the ground in Mexico right now. Are there restrictions in place?
So in Mexico, it's very difficult to talk about a single thing happening uniformly. It's been a lot of different responses in different states, some acting more aggressively, some less so, and then the federal government, some say not acting as quickly as perhaps would be prudent.
Kendall, Mexico was criticized early on for not putting restrictions in place quickly enough. What are Mexican nationals saying about the government's response to all this?
No, you're absolutely right. The Mexican government's response was slow, and this week that's changed somewhat. They have announced that they're now in stage 2, which is local transmission of the disease. And because of that, they have started to put some of these measures in place to slow the disease, asking people to stay home, extending school holidays, and even the sort of on the interesting side, they have some social media videos and this cartoon character named Susana Distancia, who shows people how to stay 6 feet apart. But yes, there's been a lot of backlash and a lot of criticism of how the president Andrés Manuel López Obrador has responded to this, the sort of slow response of the government, and then also his behavior on a personal level, holding rallies, attending events with hundreds of people where he's given hugs and handshakes and kissed babies. And so he's saying he's not going to be doing that anymore. And, but there's still a lot to see on how that's going to move forward during this crisis.
Murphy, how's the healthcare system in Sonora and beyond on the federal level equipped to handle this sort of pandemic?
There is a fair amount of anxiety about how prepared both the federal healthcare system is, as well as the healthcare systems in states around the country are for what is expected to be a great deal of demand from sick patients. So the outlet Animal Politico in Mexico has recently reported that there are a little more than 5,500 ventilators in the country, and those are, of course, used to treat very serious cases. And then there have been protests among healthcare providers, healthcare professionals, saying that they don't have access to critical equipment like gloves and masks. Even before all of this started, there were already protests being seen in Mexico about healthcare access and the quality of healthcare. And so this will likely only make a complicated situation even more challenging. But, with countries in Europe like Italy and Spain currently going through an extremely difficult time, having their healthcare systems very much overwhelmed by COVID-19, there are a great number of people worried that something similar could be seen in Mexico.
All right, and Kendall, in the short time that we have, I know there are restrictions in place along the border, primarily for essential travel. What's been the relationship like between the two border states, especially here, Arizona and Sonora, with limited travel now?
Right, exactly. So non-essential travel has now been limited, at least for entry into the United States. So that's tourism and recreation, although the border is still open for essential things like getting medical care, going to school or to work. And the US border for northbound crossers is open to US citizens and residents. That has still had a lot of impact on both sides of the border. There are a lot of border cities in the north side of the border that really rely on Mexican shoppers, both for individual businesses who need to keep their doors open and for cities who rely on those sales taxes. And south of the border, a lot of it is tourism that we won't be seeing, and so that it is going to have a large economic impact and also social impact. People have family members on both sides, but there is some difference in how the U.S. and Mexico are responding to this. So the U.S. obviously at this point has many more cases than Mexico, at least confirmed cases, and there's plenty of argument about how accurate that is. But that being the case, the U.S. has stronger restrictions. Mexico does not seem to be enforcing a lot of the same restrictions. And just this week, we saw on Wednesday protesters in Nogales, Sonora, who closed down southbound lanes to demand that the government take stronger action to spread the flow of coronavirus and to prevent people crossing the border into Mexico who might have coronavirus. And so on Thursday, we did see that there were actions being taken, people's temperatures were being taken, and that is apparently a local response directly to those protests.
All right, certainly a new normal there along the U.S.-Mexico border. All right, my thanks to both of you for your insight. We turn now to education. With the abrupt closing of schools across the nation due to the COVID-19 pandemic, parents, educators, and students are scrambling to find a new sense of normal in their remote learning environments. Their experience has been anything but textbook. Laura Siscomani, a working mother with 6 kids, describes the challenges she and her husband face now that everyone is at home all day.
So day one, I had a schedule that I had drafted up just to give our family some sense of structure. By the end of the day, I scrapped it and we're back at the drawing table. Day 2, we had a new schedule. At the end of the day, we scrapped it and we had to start all over again. It is a learning process.
Siscomani reached out to other mothers. They found much needed support and are learning to take the pressure off themselves.
Lowering the bar as a parent, as now homeschooling children is, I think, a very mentally sound thing to do, because if not, we're going to feel so overwhelmed that we will end up not enjoying our children and our family time.
Teacher Chris Falk at Sa Juanita Intermediate School also highlights the complexity of remote learning.
I can't ask everyone to say, all right, everyone get on at 8 o'clock, we're going to do a math lesson now. That's just not realistic when you have, say a family has 4 kids in the house, that's 4 different teachers asking for bandwidth at any given time. And then that's if they have 4 computers.
But he also sees a silver lining.
For my 5th graders, this is a really awesome experience for them in terms of the online classroom aspect, because so much of our world is digital. So now when they do go to middle school or high school or college, they've already done online learning and they know how to manage their time.
For Angela Valdivia, a University of Arizona nursing student, online learning couldn't come at a worse time.
Before we transitioned to online learning, I would go to clinical 2 days a week. I get to meet the patients and I got to practice so many skills, anywhere from starting an IV to learning about a mechanical ventilator.
Now clinical hours consist of videos.
We're given a case study, so basically a fake patient.
This exclusive reliance on online learning may also affect Valdivia's nursing requirements.
We need a specific number of hours in the hospital, and this makes me worried, 1, because I'm going to lack the experience, and 2, if these online hours are going to be accepted for our tests that we have to take once we graduate.
University of Arizona professors Erica and Natari Galt are sympathetic to stories like Angela's and share concerns.
My students told me they're struggling because they don't have the same technology at home, and that's been concerning.
The context of online teaching happening in a pandemic,
There's become an emotional component to the learning, I think, that is reining in on their learning experience. So figuring out some kinds of ways to channel that is something that the learning demands right now.
For a broader local perspective on how educators are grappling with a fast-changing learning landscape, we are joined by Pima County Superintendent of Schools, Dustin Williams. Dustin, thanks for being here.
Glad to be on.
I know you have regular communication with the folks up at the state legislature. What are they saying about ending this school year early?
They're going to try to keep this thing as close to them as possible. We're all on pins and needles, but it looks like the extension could come possibly maybe after the 10th. And most importantly, what we would like is the governor, if he makes the decision to say, hey, don't just close schools and leave it up to the districts, but maybe look at an extension of another 2 weeks. Then if we have to close, look at somewhere in May.
Is the writing on the wall, though?
Yeah, it's getting closer. There's just a lot of loose ends that we have to finish up, especially with some of those seniors that got to graduate and some of those college placement exams that we got to finish out. So there's still a lot of stuff that needs to be taking place in the schools, and so we do need a little bit more time.
The decision that is made potentially in the next few weeks could have impacts for next school year. Is that fair to say?
It could. I mean, most importantly, you're going to have, let's just call it, seniors aren't going to have a graduation. They're not going to be able to walk, so we're going to have to look at new strategies as far as Zoom or however you're going to do that technologically wise. But there could be some ramifications, but we'll work through all these is what's very important.
So what I'm hearing is it's not an easy decision for those parents who are frustrated at home and wondering when. I mean, there are some real conversations that have to take place.
There are. There's a lot of stuff that needs to be written, and we don't have this playbook, so we're kind of writing it as it goes. What's good is the governor has signed legislation that's passed the laws for the closure, and then we have the State Board of Education getting ready to put the rules together, and we'll have a good playbook coming up. So some good things are working right now.
Digital learning has not been the easiest thing. As you and I have talked about, there will be some winners and some people who get left out of this. What about the social component, the kids who need to go to school?
That's a great question. So 50% of school is social emotional, and it's that way of students learning how to deal with their peers and adults and having conflict and finding resolution and getting the pat on the back and getting told they're doing a great job, and we're missing that, and that's very concerning.
How does this set the stage for next school year, like August?
Well, cross our fingers, hopefully we're open in August is the big concern right here, which we think we will be, obviously. But you don't know. Again, we don't know what's happening with this pandemic. We don't know these numbers, but it's going to be swift, and it's going to be catching kids up with the cognitive learning part, but we just miss their faces and their smiles.
Words of wisdom for families who are sitting at home and watching this and wondering, how do I make sense of all these things?
Take a breath, take some rest, take some time with your family, and know that this is a time for us to try to be as positive and as happy as possible, and know that behind the scenes, schools are doing everything they possibly can, and so are the lawmakers, and so are the departments, and we're all working day in and day out, and we're here for them.
Okay, Superintendent Williams, thank you.
Thank you.
All right, now for the latest outlook here in Pima County, I'm joined by the county's Chief Medical Officer, Dr. Francisco Garcia. Dr. Garcia, thanks for being here.
Happy to be here.
As I understand it, there are about 14,000 tests, more than 900 people confirmed to have this, and of course 17 deaths, a startling number. How concerned are you about this virus here in southern Arizona?
We're always going to be concerned about what's going on. Here in Pima County, we've had 153 positive tests out of 2,170 some tests. So we are always concerned about folks who are being impacted by this. But we also are seeing that some of these folks are continuing to get better and continuing to recover. And we remain very concerned about our most vulnerable older populations, medically frail populations, because we know that they're going to bear the brunt of this crisis.
Who's considered part of that vulnerable population that you're describing?
So I think about people who are greater than 65 years of age. We should also be thinking about folks who are immune compromised, people with chronic conditions, people who are taking steroids for underlying medical conditions. Those folks are the ones that stand the most to lose and will be most impacted by this infectious agent.
Dr. Crist has said we will not hit our peak here in Arizona until at least May. That's at least 4 weeks away. How prepared are we here?
We have been working so hard with all our hospital and healthcare sector partners. I can tell you that almost every single day we are having conference calls with hospital leaders, with the leaders of the federally qualified community health centers, with the leaders of the large medical practices across this community in an effort to coordinate resources, to coordinate the kinds of things that we are going to need in those different settings in order to make things right. I can also tell you that that high level of coordination and high level of communication is really resulting in a very good situational awareness. So I know what's going on at Banner, I know what's going on at TMC or at El Rio or even at Desert Sanita in Ajo. And that makes it very, very helpful from a planning standpoint.
Do we have the right amount of equipment to prepare for the next few weeks?
You know, Lorraine, that's a hard question to ask. So we know that we do not have enough testing kits, for instance. These are very, very rare. We are doing our very, very best to procure these assets. We know that the 2 pallets, the 2 different releases of Strategic National Stockpile, as helpful as they are going to be woefully insufficient. And so we as county, we as the healthcare sector are trying to do our best to optimize the amount of resources that are coming in. But it's a tight squeeze here.
Dr. Garcia, earlier this weekend, President Trump said April 30th is the new time frame for physical distancing. What's been the impact of some of the measures we've taken here across the country and, of course, here in the state?
You know, if you think about 2 weeks ago, 3 weeks ago, the whole term social distancing was relatively unheard of, at least in the common parlance. One of the great things that we worry about, one of the things that makes me lose sleep, is the long-term cost of social distancing, especially to vulnerable communities, especially to poor folks, especially to folks who are marginated. And I really start worrying about those individuals. Remember, social distancing doesn't mean isolating yourself from the rest of the world. There are different ways of connecting. And as I run on the loop every day, I try to smile, I try to say hi to folks as we pass each other by. We need to maintain some sort of bond. I know that was one of the preoccupations of Chairman Elias, whom I spoke to almost every day for the last 3 weeks. And he was really concerned.
All right, Dr. Garcia, thank you for your insight. All right, and our thanks to you, our viewers, for watching our special edition of Arizona 360. Before we go, we do want to let you know about an upcoming opportunity to have your questions about this pandemic answered by state officials like Governor Ducey, Dr. Crist, along with leaders of the Arizona National Guard and the Arizona Department of Education. And they are all participating in a COVID-19 town hall this Thursday at 6 p.m. that we will air here on PBS 6 and NPR 89.1. You can submit your questions at azpm.org/ask. And you can find all of our continuing coverage on the pandemic on our website. For all of us here at Arizona Public Media, thanks for joining us. I'm Lorraine Rivera. Have a good night.